Thank you. Okay. Get started. Hello, everyone. On behalf of the County of Santa Clara, thank you for joining us today for this very important update. Today, you will hear from our county leadership with an update on our COVID-19 vaccine plan distribution, including updates on new locations where eligible healthcare workers can be vaccinated. You will hear first from Dr. Sarah Cody, our Health Officer and Director of Public Health here at County of Santa Clara. You will then hear from Dr. Marty Fensterscheib, our County of Santa Clara COVID-19 Testing Officer. You will then hear from Dr. Jennifer Tong, Associate Chief Medical Officer of the Santa Clara Valley Medical Center. After all speakers are done, we will head into a Q&A portion, followed by statements provided by PIO, our Public Information Officers, in Spanish, Chinese, and Vietnamese. We'll get started. Up first is Dr. Sarah Cody.
Good morning, everyone. Thank you, as always, for being here. Today, we're here to share with you some really good news. It's 2021. We had a very challenging 2020, and today we have some encouraging news to share with you all. As you know, we are still, just to set the stage here, we are still in an extraordinarily difficult place in this pandemic. We're averaging over 1,200 new cases reported a day, and we have recorded over 800 county residents who have died of COVID-19 since the beginning of the pandemic. However, in a very short period of time, in partnership with all of the healthcare systems across our county, together, many county residents have been able to be vaccinated. And that is the good news, that systems are up and running to serve the residents of our county. So I want to emphasize a couple things before we get into details from Dr. Fensterscheib and Dr. Tong. And that is that vaccination is absolutely central to working our way out of this pandemic. But even as we collectively ramp up vaccination, we still have to keep wearing our masks, not gathering, keeping our distance, and all of those things to keep us safe. We're going to be in this transition period over the next several months. I also want to give you a little bit of a framework about how vaccination works. COVID vaccination is extraordinarily complex for a number of reasons. We are following both the federal framework and the state framework in how we roll this out. So vaccine rolls out in phases. Right now, we're still in phase 1A, which includes about 140,000 people in our county, all of whom are healthcare personnel. So that's our focus now. We are really thrilled with the partnership of all healthcare systems in our county who have helped to stand up vaccination. And so the word that we want to get out is, if you fall into phase 1A, anyone who falls in phase 1A, you can go to your healthcare provider and get a vaccine. So Stanford, Palo Alto Medical Foundation, Kaiser, and the county hospital system are all ready to vaccinate their patients who are in phase 1A. And of course, our county will also be able to vaccinate people who don't fall within one of those larger healthcare systems. But all of the healthcare systems in Santa Clara County have really been extraordinary in standing up vaccination, because they did this in the middle of the biggest surge we've ever had. And they did this in the middle of the winter holidays, because vaccine arrived right on the eve of the winter holidays. And even with those challenges, all of the systems in the county have been able to stand up robust vaccination, which I think is truly extraordinary. So Next, I'd like to pass the presentation off to Dr. Finsterscheib, who will provide some additional details.
Thank you, Dr. Cody. Good afternoon. As Dr. Cody mentioned, we're really thrilled to be working in such collaboration with our partners, the other health facilities in the community. We are still in phase 1A as a county, as a state, and that means healthcare workers, along with residents of long-term care facilities, are being targeted right now for vaccinations. As was mentioned, we have approximately 140,000 healthcare personnel in this county that work here and are healthcare personnel. To date, we have vaccinated over 47,000 of those healthcare workers. Now, that does not account for some of the additional federal allocated vaccine that comes in to the VA and through the retail pharmacy program that is actually out vaccinating residents of the long-term care facilities. So 47,000 plus additional vaccines that are coming in through those other programs. We have, the county has taken it upon itself, as I've mentioned in the past, to begin vaccinating the skilled nursing facility staff. There are an estimated 6,000 of those, and to date we have vaccinated more than half of the skilled nursing facility staff, and we'll continue to offer vaccines for them. And if necessary, we will actually visit those skilled nursing facilities to continue meeting the 100% target to get them all vaccinated. So as was mentioned also, we've talked about tiers for phase 1A, which broke down clinics, outpatient, inpatient, and various other categories of healthcare personnel. But at this point, the state has given the directive for all persons who are healthcare personnel to now be vaccinated. And so all of those persons can make arrangements through their own healthcare facilities where they get their healthcare, whether it's at PAMF or whether it's at Stanford or Kaiser or the Valley, to make an appointment and get vaccinated. We have, again, been working very closely, and vaccine has been allocated to those facilities, and they are standing by to vaccinate their patients who are in the phase 1 category. We have a new website that is up and has all of the links so that anybody that doesn't know how to get in touch with their facility, their provider, can go to a link which we've made very easy. It's sccfreevax.org, sccfreevax.org. We also want to remind everyone again, as was also mentioned by Dr. Cody, that until we really have the majority of our residents vaccinated in our county, which will take several months to do, we must still keep our masks on, maintain our social distancing, and be very vigilant, because there's still plenty of virus circulating in our community. And until such time as we get everyone vaccinated, or a majority of vaccinations, into the arms of people in our community, we cannot let our guard down. So again, very exciting news. We're very happy to announce our efforts with everyone else. The next phases that we will be moving into, which of course everybody wants to know when is it their turn, will be a phase B, and we are hoping to be able to move to that phase by the end of the month, sometime by the end of the month. Again, dependent on the amount of vaccine that we expect to arrive. And so more information on that to come. And now I'd like to turn this over to Dr. Jennifer Tong.
We are very hopeful that this marks a turning point in the pandemic. The hospitals and clinics operated by the County of Santa Clara are very proud that we have achieved the ability to offer vaccines to those who are currently eligible, healthcare personnel in phase 1A. Over the past 3 days, we have opened 3 different clinics for vaccination. Next week, we open another large site, and we will continue further expanding the capacity at each of these sites to reach more people. This has been an extremely complex effort spanning technology development, space development, staffing, training, outreach. Having personally been involved in many complex healthcare transitions over the years, I can say with confidence this is by far the most complex that we have seen yet. Each healthcare system in our county is trying to address this unprecedented effort in the most efficient and effective way possible. We stand together with the community and the other health systems in our county to really achieve this turning point in the pandemic. Thank you. With that, I'll turn it over to Supervisor Otto Lee.
Good morning and welcome, and thank you for coming this morning. I'm very pleased to join our dedicated county healthcare professionals as the county announces expanded vaccination sites that we talked about. Today here at the Valley Health Center in Tully, we are very pleased that this site will be an additional facility to administer our vaccines. And we're very pleased that the state has also expanded the eligibility for vaccinations to practically all healthcare workers. And we urge those individuals to get vaccinated as soon as possible. I also want to thank specifically Dr. Sarah Cody, Dr. Fenderstein, and also Dr. Jennifer Tong for their leadership and hard work in this difficult times. Your efforts have absolutely saved so many lives and prevented so many more thousands of residents from getting sick of this deadly virus. And I of course want to thank all our dedicated nurses and healthcare professionals for the incredible efforts of making sure the vaccines are received and administered as safely but as quickly as possible as well. Today's announcement underscores the county's commitment to more than 40,000 healthcare workers who have received the first doses of the COVID-19 vaccines. These additional vaccination sites are absolutely necessary as we come together to fight this pandemic. As we have seen, this issue is now revolving besides being a medical issue, it becomes a logistical issue. We're talking about getting enough people out there to get the vaccines out in a timely manner and making sure that they are qualified and they're safe. And we're doing as best as we can as a county. And I'm so proud to say that these are all coming together. At this point, we're looking at potentially rising up to 6,000 vaccinations a day is what we're looking at by next week. And these are some great numbers that we're hoping to achieve very quickly, ramping up. And I want to thank our healthcare and county professionals for making this happen. As much as this is a good news for the light of the end of the tunnel that we could see, the numbers are still horrible. As of yesterday, we just had our first day in the United States, over 4,000 people died. 4,000. That's more than how many perished in one day in 9/11. Let's put that in perspective. And the message is telling people is, please don't go out. As much as you want to get together with friends, it is extremely dangerous. Wearing masks is absolutely important. And I want to make sure with the Lunar New Year coming by, many of us would love to see our loved ones, but this is absolutely the wrong thing to do. We have to use technology, whether it's through Zoom or WebEx or Microsoft team meetings and whatnot. This is the only way we really could get to see each other, because we absolutely want to make sure that we could live through this. And yes, we will, because of the fact that these vaccines are going to our skilled nursing facilities, and partners like drugstores like CVS and Walgreens are also getting the vaccines directly to give to many of our skilled nursing facilities members and patients. We could beat this thing, but we need everybody to hunker down for the last time. This next few weeks and next few months will be so crucial to get that out. And I just want to say thank you everybody for putting up this hard, difficult decisions and times that we're going through. But we will make this. One other good news I want to say I've heard in the news this morning is that this new variant that we heard that's going on in UK looks like the good news is the vaccine they've been vaccinating is effective against it, which is really amazing. So I just want to make sure people understand the safety and how important it is to get the vaccinations. Don't doubt this. When you're able to get this vaccine, please come. Please come. Please get in line and get it done as soon as possible to protect yourself and protect your loved ones. Thank you very much. Thank you.
Thank you, Supervisor Lee. Thank you, doctors. So we're going to head into our Q&A portion now. Because this event is being live streamed on our Facebook channel, our speakers will repeat the question before they answer. First question, Devin?
So this is a question for Dr. Finsterstein. You have kind of framed the vaccination numbers thus far as a success story, it is my understanding that the county has received roughly 105,000 doses of the vaccine. Fewer than half of that has ended up in someone's arm. What kind of accounts for the delay in getting those other available doses administered, and what could speed that up?
Right, so the question is, we've given about over 47,000. We have received, the county has been allocated, I should say, 110,000. It's very important for initially all of that vaccine to get into the hands of the providers. And so all of the hospitals have received all of the vaccine that is required for them to meet the needs of all of their staff, plus begin doing the rest of the vaccination. As was mentioned, it's a complicated process. The hospitals have outreach to their staff, and they're in the process of getting all of them vaccinated. They have not all been vaccinated yet. That's why all of the vaccine is not in the arms of everyone, but they're all working very hard. There's issues, which is a good point. It brings up the issues of people's fears about the safety, the hesitancy that some people have, but this vaccine is a safe vaccine and should be utilized. And so I think once we get over that hump and people accept the vaccine more readily, you'll see that number rise considerably.
If I could, just a quick follow-up. I did a little quick math after you gave us the 47,000 number. At the current rate, if nothing is accelerated, according to my calculations, it would take roughly 2.5 years to administer the vaccine to the 2 million people currently in the county. What do we do to get this faster? Because obviously that's too slow.
Right. And I would just go back to the fact that I was involved, and Dr. Tong was involved in the testing of this community for the virus. It took a considerable effort. We started slow. We were just doing a couple hundred people testing a day at the fairgrounds. Now we're doing 5,000-6,000 a day, 20,000. So I think it's expected to start slowly, and we will absolutely ramp up. We've heard that the federal government under the new administration is going to push out a lot more vaccine. The plan is to open many more mass vac sites. So we know that it's going to take time, but I think we're going to speed up our effort and work toward getting everyone vaccinated in just much shorter time than 2.5 years, that's for sure.
One last question for you. You said 140,000 people in Tier 1A, 110,000 doses. With what degree of confidence do you think you need 3 times as much as you currently have for everyone to get a first and second dose? How confident are you that resupplies will be here in time to do that?
Right, we don't have control over the federal government, but we have been promised those, and I think we will be getting those. There's no reason that the vaccine manufacturers have said not to provide us. We've already gotten additional doses that are going to be used as second doses, so we expect that we will have all the doses that we need.
Dr. Cody? Have there been any instances of anybody having any kind of reaction to the vaccine in any ways, minor or major? And can you talk a little bit about what's in the vaccine for people who are worried about coming in to get it?
So the question is about adverse reactions and what's in the vaccine. To be perfectly honest, I don't have the data on adverse reactions. Adverse reactions to any vaccine, there's a reporting system for them, VAERS, the Vaccine Adverse Events Reporting System. And so maybe we can look into getting some kind of information back to you, not something that we hold right now. I'm not an expert on vaccines. This is a different kind of vaccine than most vaccines we're familiar with, both in the way it was manufactured and what kind of a vaccine it is. But the trials were rather large, and we feel confident based on what's been shared with us at the local, state, and federal level about the safety and effectiveness of the vaccine.
Dr. Cody, how and when do we find out whether the vaccine is actually having an effect on the numbers, bringing them down?
Thank you. The question is, how do we know when and whether the vaccine is having an effect on bringing the numbers down? So I will answer that question with a couple of comments. What we're aiming for, our big, hairy, audacious goal, is to get to 85% herd immunity. That's a number that Dr. Fauci described. It is a guess, but I think it's a very robust guess as to what our goal needs to be. We know that part of our population is already protected because they've had the infection. However, we also know that the recommendation is for everyone to get vaccinated regardless of their history of having had COVID or not. And so by our calculation, we need to have over 1.5 million people in our county vaccinated, which means that, as Dr. Fensterscheib said, all systems, all healthcare delivery systems in the county are going to need to grow the capacity to vaccinate at a fairly rapid clip. As we mentioned earlier, I think that what we've seen so far is promising because our healthcare systems were able to bring up vaccinations in the middle of responding to the biggest surge we've ever had and over a holiday. Remember that the first doses of vaccine didn't arrive into the county until the week before Christmas. So I just wanted to provide that context because that reassures me. Even the most complicated effort we've ever undertaken in the middle of some extraordinarily complex times, we've gotten as far as we have in a relatively short period of time.
What are they now, and are they where you expect them to be currently? And then what do you anticipate their direction will go?
The question is about the number of hospitalizations. Where are we and where do we expect to be? As of this morning, well, I would say over the last several days, the ICU capacity, which is what we watch very closely, we are down to, it's ranging between 20 to 25 ICU beds across the entire county. So that's very low. That's very worrisome. Our capacity in every hospital is stretched, and we are also, of course, wanting to help other counties and other regions, right? We're trying to do our part to take care of everybody. So we are by no means out of the woods. We are really in the thick of it. The projections vary by the day. I think the key unknown, which is why I can't project what's going to happen, is what bump will we see in our cases as a result of holiday travel and gathering. So we saw a significant bump after Thanksgiving that's now been translated into hospitalizations and an overwhelm of the system. We don't yet know what the effect of Christmas and New Year's travel will be. So that's the big unknown. What I will say is that our hospitals have been enormously collaborative as far as balancing the load. So we're really looking at the hospitals across the county as a system, and they are doing a good job of helping each other out and balancing things, so that as much as possible, anybody who needs a healthcare resource has access.
So some people have suggested that we need kind of an effort on the scale of just a mass vaccination center or centers that perhaps run 24/7. Is there a plan for something of that scale? Is there money? Is there staff in order to sort of make that a reality?
The question is around mass vaccination. Is there like a 24/7 mass vaccination, and is there money? Is there a plan? And the answer to that is, on behalf of the county, there is not a plan currently for something like a 24/7 mass vaccination. I want to emphasize, I'm not a logistics person as our supervisor Lee is, but even I can appreciate the complexity of this. And let me just lay out a couple of the variables that make this so complex. Number one, the storage and handling for the vaccines currently available. The Pfizer vaccine that requires a freezer of minus 70 degrees, and then some very particular storage and handling. The Moderna vaccine, minus 20 degree freezer. So that means that design kind of has to be around the proximity to the freezer. So that makes this vaccine pretty different. Number two, we have 2 vaccines now, but in the future we may anticipate there are different vaccines. Each is under emergency use authorization, which means there's very particular procedures in order to give the vaccine. It's not like just giving the flu vaccine. And they're different for each vaccine. And if you add on to that it's not like the flu vaccine where we say everyone 6 months of age and up needs to get vaccinated, come now. Rather, it's going out in phases based on priority group, adds a significant layer of complexity.
Last question.
So we are hearing, or we've heard some police officers who are questioning why they're not getting the vaccine when firefighters are. Maybe can you explain why, or is there when maybe police officers can expect to start receiving?
So the question is around police officers, law enforcement. When will law enforcement be vaccinated? And a comment that firefighters are already in process of getting vaccinated. As Dr. Fensterscheib and I have described, Phase 1A is for healthcare personnel. Fire paramedics are included as healthcare personnel. And so they belong in Phase 1A and have been offered vaccine. Law enforcement is not in Phase 1A. As soon as I believe they're in Phase 1B, although I have to go check, as soon as they're in the priority group, they will of course be offered vaccine. And again, remember, all of the healthcare systems operating in our county are receiving vaccine and ready to vaccinate their patients once they come into a eligible group.
One last question.
Is there a specific time? Is there a date in which you would like to complete Phase 1, 1A, begin Phase 1B, complete 1B? I just want to kind of get you on the record if there is a timeline.
Right. The question is there a timeline for the phases? And the answer is, we are trying to get through Phase 1A as fast as we can. All hands on deck effort, right? All hands on deck effort. As soon as we are confident that the people eligible for Phase 1A have access to their appointment and have made their appointment, then we will be able to transition into Phase 1B. It was really just in the last 48 hours that we got confirmation from the California Department of Public Health that we could offer vaccination to everyone in Phase 1A. Prior to that, we were moving tier by tier, which makes it more complex. So I think that now we will be able to go faster, and that's great for everybody. Thank you.
Okay, this now concludes our English language and American Sign Language portion of the press event. We will now provide a Spanish language statement, followed by a Vietnamese language statement and Chinese language statement. Thank you.
Yeah, absolutely. Hey, tell everybody I mess up.
Sure.
Until I tell you to stop, just keep going. Okay. All right. Yeah. Let's go. Keep rolling. All right. Yeah, I want to make sure.
Muy buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el Condado de Santa Clara. El día de hoy acabamos de anunciar que el condado está urgiendo a todos los trabajadores de salud a recibir la vacuna contra el COVID-19. Más de 47,000 ya recibieron su primera dosis del sistema de salud que ha comenzado a distribuir estas vacunas. Como recordamos, las vacunas empezaron a ser distribuidas el día 17 de diciembre del año 2020. Hasta ahorita ya llevamos más de 47,000 personas quienes han recibido su primera dosis. Esta semana se está aplicando la segunda dosis a aquellas personas quienes ya han recibido su dosis. El Departamento de Salud Pública del Estado de California anunció la amplia elegibilidad para la vacuna contra el COVID-19 a todos los trabajadores de salud en cualquier nivel de la fase 1A. Anteriormente solamente se estaban vacunando a personas quienes estaban en la fase 1A dependiendo en los niveles o tiers. El sistema de salud ha ampliado su capacidad para garantizar que todas las personas elegibles reciban la vacuna rápidamente. Actualmente tenemos en el condado de Santa Clara aproximadamente 140,000 trabajadores de salud quienes califican para recibir la vacuna durante la fase 1A. Si usted califica durante la fase 1A, por favor visite a su proveedor para que usted pueda hacer su cita para recibir la vacuna. Estos proveedores incluyen Kaiser Permanente, Palo Alto Medical Foundation, Stanford Healthcare, Santa Clara Valley Medical Center. Si usted califica durante la fase 1A y no tiene proveedor médico o no escuchó el nombre de su proveedor médico, usted también puede hacer su cita bajo los hospitales del condado. Puede visitar nuestra página web para saber si usted califica durante este grupo y darle todo paso a paso en cómo hacer una cita para recibir la vacuna contra el COVID-19. Nuestra página web es www.sccfreevax.org. Una vez más, esa página web es www.sccfreevax.org. Allí podrán encontrar información acerca de los siguientes niveles y los grupos de personas que califican para el nivel 1A, también para el 1B y para el 1C y eventualmente el nivel 2. Muchas gracias.
Magandang hapon ho, magandang umaga mga kababayan. Ako si Ted Gomez ng Public Health Emergency Operation Center. Ako ho ang naglilingkod ng Public Information Officer. Mahigit na 40,000 na ho na healthcare workers ang nakatanggap ng unang bakuna ng COVID-19. Ngayong linggo, naumpisahan na ho rin ang pagbibigay ng pangalawang bakuna para sa lahat ng mga healthcare worker na kabilang sa Tier 1 ng Phase 1A sa healthcare system sa buong county at walang pagod na sinisigurado sa bawat linggong may dumarating ay mabigyan sa lalo't madaling panahon ang mga pwedeng bakunahan. May estimated na 140,000 healthcare workers sa Santa Clara County at ang distribusyon na sinasagawa sa paraan phase at tier system na itinakda ng state at federal government. Sa ilalim ng phase 1A at tier 1 na unang focus ay hospital staff at residente ng long-term care facilities, medical responders at dialysis centers. Sisimulan ang bakuna para sa Phase 1B sa katapusan ng buwan. Ang Santa Clara County ay nakikipag-ugnayan sa mga malaking healthcare system at mga kasosyo nito sa kabuuan ng county para mabigyan ng access ang mga hindi pa napili makatanggap ng bakuna mula sa kanilang employer. Para sa magpa-schedule ng appointment sa bakuna, ang mga healthcare personnel ay maaaring tumawag sa kanilang healthcare provider tulad ng Stanford Healthcare, Kaiser Permanente, Palo Alto Medical Foundation, o Santa Clara Valley Medical Hospital and Clinic. Ang mga healthcare providers na hindi pasyente nitong mga entities ay maaaring mabakunahan sa pamamaraan ng health at hospital system ng county o ibang provider tulad ng El Camino Health. Para sa mga karagdagang impormasyon, maaari po lamang magtungo sa www.sccgov.org coronavirus. At kung kayo ay naghahanap o nangangailangan ng libreng COVID-19 test, magtungo sa www.sccfreetest.org. Maraming salamat po.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay quận hạt Santa Clara đã đưa ra một buổi họp báo để đưa đến cho quý vị những thông tin liên quan đến vaccine COVID-19. Kính thưa quý vị, hơn 40.000 nhân viên y tế trong quận hạt đã được chủng ngừa COVID-19 mũi đầu tiên và hệ thống y tế đã bắt đầu tiến hành tiêm chủng mũi thứ hai trong tuần này. Chính quyền liên bang và tiểu bang đã ấn định các giai đoạn cho biết lúc nào các nhóm khác nhau sẽ được chủng ngừa COVID-19. Bộ Y tế tiểu bang California đã mở rộng tiêm chủng và thông báo rằng tất cả những nhân viên y tế hội đủ điều kiện trong giai đoạn 1A sẽ được chủng ngừa COVID-19. Nếu quý vị muốn biết mình có được chủng ngừa trong giai đoạn này không thì quý vị hãy vào trang mạng sccfreevax.org. Kính thưa quý vị, trong cái trang mạng này thì chúng tôi có đầy đủ những cái giai đoạn, những cái nhân viên hội đủ điều kiện trong từng giai đoạn thì quý vị có thể theo dõi những cái nhân viên này một cách dễ dàng hơn. Nếu quý vị hội đủ điều kiện để được chủng ngừa nhưng nơi quý vị làm việc không cung cấp dịch vụ chủng ngừa trực tiếp, quý vị có thể liên lạc với các bệnh viện thuộc hệ thống bảo hiểm của quý vị để được hẹn chích ngừa. Ví dụ như là Santa Clara Valley Medical Center, Kaiser, Stanford và Palo Alto Medical Foundation thì những cái hệ thống bệnh viện thuộc những cái bệnh viện này sẽ cung cấp cái việc chủng ngừa cho những bệnh nhân cũng như là những nhân viên của họ trực tiếp. Hoặc nếu như mà bảo hiểm của quý vị không nằm trong hệ thống bệnh viện này thì quý vị có thể nhận được vaccine từ hệ thống bệnh viện của quận hạt Santa Clara cũng như là El Camino Health. Thì quý vị có thể đi lên trên trang mạng của chúng tôi là sccfreevax.org để quý vị có thể tìm hiểu thêm được những thông tin và nếu như mà quý vị có những cái thắc mắc thì quý vị có thể gửi những cái thắc mắc của quý vị vào thẳng trong inbox của Facebook Sở Y tế quận hạt Santa Clara thì chúng tôi sẽ cố gắng đưa đến cho quý vị những cái câu trả lời nhanh nhất. Kính thưa quý vị, có khoảng 140.000 nhân viên y tế sẽ được chủng ngừa trong giai đoạn 1A tại quận hạt Santa Clara. Ngay sau khi những ai có hội đủ điều kiện trong giai đoạn 1A được tiêm chủng rồi thì tiểu bang sẽ cho phép các quận hạt được chủng ngừa những người thuộc giai đoạn 1B, bao gồm những người từ 75 tuổi trở lên và các nhân viên thiết yếu tuyến đầu. Tính đến thời điểm hiện tại thì quận hạt có tổng cộng 110.280 liều thuốc chủng ngừa cho mũi đầu tiên và 17.320 liều dành cho mũi thứ hai, cộng thêm với những liều bổ sung sẽ gửi trực tiếp đến các cơ sở y tế lớn. Hiện nay thì quận hạt có thể cung cấp vaccine COVID-19 lên đến 6.000 người mỗi ngày. Thành ra là nếu như quý vị là những cái nhân viên mà thuộc trong giai đoạn 1A và quý vị có hội đủ điều kiện rồi thì quý vị hãy đi chích ngừa sớm nhất có thể và quý vị có thể tìm thấy thông tin về việc đặt hẹn và chích ngừa trên trang mạng của Sở Y tế Công cộng quận hạt Santa Clara hoặc là quý vị có thể vào thẳng cái trang mạng là sccfreevax.org. Trong thời gian chờ vaccine đến với tất cả mọi người thì chúng tôi vẫn khuyến khích quý vị là hãy luôn giữ khoảng cách an toàn khi mà đi ra ngoài với người khác, hoặc là quý vị khi mà quý vị đi ra ngoài là hãy đeo khẩu trang và luôn luôn rửa tay thường xuyên. Chúc quý vị thật nhiều sức khỏe và chúng tôi sẽ đưa đến cho quý vị những cái thông tin khác. Nếu như mà quý vị muốn biết thêm những cái thông tin về COVID-19 thì quý vị hãy vào trang mạng là www.scc.gov.org/coronavirus và chọn ngôn ngữ thích hợp. Xin cảm ơn.
大家好，我是圣塔克拉拉县紧急行动中心的 Anchang。今天的记者会主要是向大家提供更多新冠疫苗的更新，并且呼吁所有的医疗人员都能接受新冠疫苗的接种。第一批新冠疫苗在美国获准使用之后，在12月中，圣塔克拉拉县已经接收到，并且呢开始为第一阶段符合条件的人施打疫苗。至今已经超过了4万名的医疗人员接受第一剂的疫苗施打，而在这周也开始了第2剂的疫苗施打。加州公共卫生部门宣布了对医疗人员扩大第1阶段疫苗的施打，圣县的所有医疗系统也都已经加快了脚步，为符合条件的医疗人员进行新冠疫苗的施打。每个星期呢，我们都已经收到更多的疫苗了。在圣县大约有14万名的医疗工作者，而疫苗的施打是根据联邦和加州的政府所制定的阶段和等级系统来分配。在1A 阶段的重点呢，是在医院的医护人员、长期照护中心的住民，还有工作人员、先遣人员和洗肾中心。第2和第3等级是居家照护人员、中继照护设施、社区健康工作人员、公共健康外勤人员、初级保健诊所员工、特殊诊所、化验室的员工，还有牙科和其他口腔卫生的诊所。圣塔克拉拉县也和县里面大型的医疗系统合作，来实施疫苗的施打。如果您是符合第1阶段疫苗施打的人士或是医疗人员，可以跟自己的医疗保健提供方预约来接受疫苗。目前疫苗的施打都是透过预约的。截至目前，圣县已经收到超过11万剂的第1剂疫苗，还有17320剂的第2剂疫苗，还有更多的疫苗呢是直接运送到跨县的大型医疗系统，像是 Kaiser 还有 Sutter Health。当大部分1A 阶段符合条件的人士都已经接受了疫苗之后呢，加州政府就会开始允许1B 阶段的人员开始接受施打，其中包括了75岁和以上的人士，还有前线必要工作人员。更多的详情可以参考新冠疫苗的网页 SCC.freevax.org，SCC.freevax.org， 可以选择中文的页面。在此提醒，就算打了疫苗，还是要继续防疫的措施，请大家继续的勤洗手、戴口罩、保持社交距离。祝大家平安健康，谢谢。